Breaking tonight, the Washington Post reports health agencies are investigating whether Taco Bell may be linked to the nationwide cyclosporiasis outbreak. We're talking lettuce and salad greens as a possible source, but officials have not identified a specific food, brand, or supplier. There are now thousands of cases of cyclosporiasis reported across the country, across 30 states. Several of them are in the DMV. Joining us now is Dr. Miriam Fischer, emergency medicine physician with MedStar Health. Thank you so much for joining us.
Afternoon.
Okay, so we have a lot of questions, so we'll get to as many as we can. Investigators are now eyeing, as we mentioned, a popular fast food chain, Taco Bell, as a potential source, among others. Federal and health state agencies have not pinpointed exactly where the other sources are. So there are so many questions, but we know that lettuce and salad greens could be a source and contributing to this. What do we keep in mind as we continue to hear about more cases? Does that mean people should avoid eating salads, or what's the guidance here?
I think it helps to have a little perspective. Nobody wants this. Nobody wants to be sick. But there have been, so far from May 1st to July 7th, there have been 28 cases in Maryland and 10 cases in Virginia and no cases yet in DC. Now, granted, we think it is much underreported, but we're talking about 141 hospitalizations nationally and no deaths. So to put it all in perspective, this is small numbers. People are not dying. Very few people are being hospitalized. And so, for example, I still ate salad for lunch today. It was delicious. There are things we can do to remove our risk and reduce it and be cautious, but I don't think this needs, I've had multiple people ask me, should I stop eating all fruits and vegetables? I don't think we need to go to those extremes. And I think we can just be thoughtful and cautious about what we eat to keep ourselves safe.
A very good message there. I think it's also important to point out that this is not new. It's been around, but we're suddenly hearing so much about it due to the growing number of cases, of course, being reported. What should the average family be worried or simply aware of? I know you mentioned you have not stopped eating salads, but to those who are a little more concerned or heightened with that concern, what's the message there?
So I think, first of all, the highest risk, the most number of cases have been in Michigan, New York, Ohio, Illinois, Indiana, Kentucky. Those are all places that are seeing higher than numbers. The DMV is notably not one of those places. That being said, washing our hands, washing our vegetables, those basic things help lower the risk. The other things we can do is, because we think it might be linked to lettuce or salad greens, don't buy the salad that's in a bag. Buy the big salad piece and then take off the first few layers, because again, the risk is from the handling, the growth, the handling, the harvesting of the vegetable and the fruit. And so things that haven't been touched are much safer. You can peel something and the inside layer should be nice and good and healthy and happy and enjoyable to eat.
Aside from lettuce and salad mixes, what about other vegetables and fruits, if you can weigh in on that?
So far, the link that the Michigan health officials have made has been to lettuce or salad green. But in the past, this parasite has been linked to raspberries, to basil, to cilantro, to other berry mixes, to snow peas and snap peas. If you think about anything that gets handled a lot more and things that have outsides that you end up eating, those are the highest risk fruits and vegetables. And those are things that if you're high risk, if you have a low risk tolerance, if you're worried about it, those are easy things to avoid and to still keep those fruits and vegetables and stay healthy.
Our time is fleeting here, but I just want to get to some of the symptoms here. We've heard about some of the severe symptoms being explosive diarrhea. That seems to be dominating the headlines. How do you know at what point, look, this isn't just a stomach bug, I really need to get to a doctor?
So this is not pleasant, but again, there are no deaths reported. Diarrhea, abdominal pain, bloating, vomiting. The difference between this parasite and a lot of these other foodborne illnesses is that this is not self-limiting. This does need treatment. And the way that you get treatment is you have to get tested first. So it requires, and that's why we think that there's some limited reporting and underreporting, because you have to go get a fecal sample. Nobody really wants to do that. And then you do need antibiotics. So if you have one of these sort of foodborne illnesses, maybe these diarrhea-like symptoms, and it's not getting better, that would be a good time to go in and get tested and see if you need treatment.
Okay, good to know. Dr. Miriam Fischer, we appreciate all of this information and insight, and I'm sure we'll be chatting with you soon. Thank you so much.
Absolutely. And as a last minute reminder, don't forget to wash those hands. That can really make a difference.
Just the basics, right? Sometimes it's as simple as that, washing your hands for 20 seconds or more. Thank you so much. All righty.